Okay, thank you, Dietmar, for introducing me, so I can also go forward to the actual theme. So, good morning, everyone. I'm going to tell you about mental health promotion at social and healthcare workplaces. This presentation is based on 4 scientific peer-reviewed journal articles, of which 3 have been published already, and the 4th one has been submitted. And this is the core of my PhD thesis. So in the next 12 minutes or so, I'm going to tell you why mental health promotion is important, how mental health promotion interventions have been conducted before, and what things should be considered when promoting mental health at social and healthcare. So to start with, why mental health issues are important to study. When we started our research project in the beginning of 2020, we saw that in the official statistics in Finland that mental health issues were the #1 cause for sickness allowances and early retirements. And we saw from our job well-being surveys that roughly 1/3 of all social and healthcare workers in Finland suffer from psychological distress, so anxiety and depression symptoms. So what we have then, after the beginning of our project, what we have seen due to COVID-19 pandemic, the increase of the mental health problems. So that was just like getting the situation from bad to worse. So the situation was bad even before. And in the big picture, so this is very important because especially in Finland, we have a lot of social and healthcare workers retiring soon, so we really can't afford losing any young or like the workforce due to mental health reasons. So we thought that in this project we need to find solutions and support for the social and healthcare organizations, and especially aim to look for effective interventions. So our study aims were, first of all, to review previous mental health interventions. We were especially interested in organizational level interventions, which are like participatory, co-creational ones that aim to tackle work stress and working environment. And secondly, we wanted to generate hypotheses for future interventions, especially organizational level interventions. And we focused on psychosocial work stressors because we know from previous research that they increase the risk for mental health problems. So we started with this scoping review of interventions to promote mental health at social and healthcare workplaces. We found from 3 databases 1,518 studies, which after screening we included 76 in the final review. And the main findings were, first of all, that the interventions focused mostly on individual workers. Only 6 of them aimed to tackle the work stress or the working environment. So there's a clear gap in research considering this area, these organizational level interventions. And secondly, we found only little or no consistent evidence of effectiveness of any kind of interventions, including the individual ones. There were some studied reported effective results of some intervention types, but then there were also some that didn't show effectiveness. So due to this finding, we moved forward to look at the the work stress, the working environment, and we aim to generate these hypotheses for future interventions. We focused on 3 psychosocial work stressors: job demands, job rewards, and workplace social capital, which are all important factors in social and healthcare work, and which have been shown to increase the risk for mental health problems before. So we were especially, this figure aims to show that we were interested in accumulation of several stressors. So we want to find out that if there's several, in this case 3 stressors experienced simultaneously in the workforce or the single workers, is there like excess risk, synergistic interaction effect that increases the risk for mental health problems even more than just like the sum of it. So we started with the cross-sectional study of 9,855 workers using our job well-being survey data from 2021. And we calculated relative excess risk for due to interaction effect of one-way, two-way, and three-way interactions of these stressors. And we found that if a person or the worker is experiencing all three stressors simultaneously, the excess risk for psychological distress is 6-fold. So this means that there's like the impact is bigger than the sum of its components. So we really need to look at this accumulation of work stressors in the future. Secondly, we moved on to study what could maybe help or alleviate this synergistic interaction effect. So we looked at not individual workers, but in this study, work units, 813 work units in social and healthcare organizations in 21 data. And we found again a synergistic interaction effect of high demands and low rewards. Odds ratio was 9.27. And so there was a strong association between these 2 stressors and psychological distress on work unit level. But when in a stepwise logistic regression model, we introduced the social capital, workplace social capital to the model, the odds ratio of the interaction effect decreased from 9 to 7. And social capital itself also had an odds ratio of 0.31, which means that it's protective for psychological distress by itself also. And finally, we conducted like a test of an organizational level intervention. We conducted a pseudo experiment of 3,600 workers. We looked at the improvement of work stressors between 2019 and 2020 data, and looked at the outcome of psychological distress in 21, so the level there. And using propensity score matching, we balanced the pseudo intervention group and the pseudo control group so that they were like a similar kind. And we looked at that if we improve the stressors, does it have an effect on psychological distress? A little bit surprise was that in total sample, there was no statistically significant effect. However, when we looked at the age-specific analysis, we saw that on workers under 50 years old, so improving 2 or 3 stressors simultaneously, so that decreased the risk for psychological distress by 41%. And among workers of age 50 or more, so improving job rewards was beneficial. and decreased the risk for psychological distress by 23%. So, to sum the findings up, so we saw that organizational interventions in the scoping review, we found that we are lacking evidence from them, so they are needed in the future. But in the future organizational level interventions, we need to, we should consider the interaction effect of accumulating work stresses. As we saw, it can increase the risk, like markedly, the risk for mental health problems. And finally, we have to look at the participatory effect, the workplace social capital. So, like if you yesterday listened to Luke Bowen's and his presentation of Vital at Work intervention, so that's a good example of participatory intervention that we really need. But on the other hand, we saw that the synergistic interaction effect, so it increases the risk for psychological distress, but removing those stressors didn't have that much of an effect. So to me it seems that organizational level interventions and tackling work stress doesn't help by itself. It's not the only solution. We also need individual level interventions because mental health problems, they have so much risk factors, not only the work level things. So secondly, we also need to prevent psychosocial stress if we want to prevent mental health problems. And finally, as we saw that the effect of improving work stress or the stressors had a different effect on workers under 50 and over 50. So we need to customize the interventions for different worker groups and probably also for different occupational groups. We didn't tackle that in our study, but that should be studied more. So, in the end, I have the references of the 4 articles, and yeah, I thank you for your attention, and I'm open to answer questions if you have any. Thank you.